Good evening, all. Welcoming you all to Samson's Medlin Academy's free webinar as well as the demo class. So here I am to talk regarding the important informations or all about that you need to know regarding the General Dentist Gulf Licensing Exams 2025. So here in the session, we will be really regarding the important aspects that you have to know regarding each of the examinations that has been mentioned here. Let it be the GCC exams like the DHA, General Dentist exams, DOH, MOH, QCHP or the DHP, that is the licensing exams for this Qatar Council. And then we will be talking regarding the requirements for this Oman exams, MOH, Kuwait, that is also called as the KDLE, Kuwait Dental Licensing Exams. And also we'll be talking regarding NHRA or the Bahrain Licensing Examinations and also the SDLE, that is the Saudi Dental Licensing Examinations. Yeah, so to just brief you regarding Samson's Medlin Academy, we are in this field for nearly with 8 years of experience in this Gulf Dental exam preparatory coaching, and the need regarding why is there or is there a need that we will have to go for a coaching center and then to prepare for all of these competitive exams. If that is a question that has been asked, I would definitely tell yes, because there is actually a significant gap between what is being taught in our colleges as well as the universities and what is actually clinically practiced. And when it comes towards the licensing exams, they are actually trying to judge us not based on our clinical knowledge or probably what we have been learning from all of those books that we studied in our colleges or the universities. So in order to bridge this gap between what is being taught at the colleges as well as what is being practiced. That is the reason why we guys are been providing you with the necessary coaching for all of this preparatory Gulf examinations. Okay, so basically we are here to guide the qualified dentists to prepare for this dental licensing examinations across the Gulf countries, enabling the dentists to be registered and to legally practice in all of the Gulf nations. Yes, so to continue with the course highlights. So as you all know, as most of you are already there in our common group, you must be very much aware regarding the posters that has been circulating in our groups, and also to just give a brief introduction regarding the course. As you guys know, we have daily sessions, the daily basic concept clearing sessions, which has been running from Monday to Friday. So we have 2 batches per day. So we have a morning batch which is being timed at 7:30 a.m. IST Indian time, and then we also have another batch which is at 8:30 p.m. evening 8:30 p.m. which will last for nearly 1 hour to 1 hour and 15 minutes. Okay, so per day we have 2 sessions, and the sessions that is dealt in the morning will be completely different from that of the session that will be dealt in the evening. That is, for example, if the subject that we are dealing with the morning batch is endodontics, so for the evening batch it will be prosthodontics. We don't have or like the 2 batches are completely separate. It's not continuous. So according to your convenience, you can enroll either into the morning batch or into the evening batch. And then other than that, we also have the online examinations as well as the discussions. And then we also have the Q&A discussions based on the previous papers, individual assessments, necessary study aids, as well as the updated study materials. And then we have different daily practice MCQs through the mobile app. So to specify regarding the mobile app, as most of you know, we have an app which is in the name of Samson's Medlin Academy app, which you could download either from the Play Store or the App Store. And that is how all of the materials are being delivered to you. So you can purchase it from your own end by just clicking on the button there, but choosing the adequate course. And once when you make the payment, it is all auto-generated, because of which directly you will get into the contents, and that is where you get to see all of the mentioned contents here. Okay, and there you will also have updated pattern of this mock exams. And then above all, the highlight what I would like to just specify, or I would like to highlight once again, is that the course that we are going to purchase, which is priced at 12,000 currently, after or as a reason of this Onam offer, the regular course fee is 14,000, which has been at an offer price of rupees 12,000 running from 24th August, that is right from tomorrow, to September 1st. Okay, so in these days you can purchase the course for 12 months, for at the amount of 12,000, and above all, it will be valid for 6 months from the day of purchase. probably if you compare with that of the other academies, or probably if you just inquire with that of your friends, you will get to know that, or high chance that you will find that this is a striking feature of our course. Okay, so without any further ado, let's get into the syllabus discussion as well as the different examinations in detail. Yeah, so though most of the parametric examinations give a syllabus as a whole, you can see that these are the different topics that are thought to carry the most significance in general dentist parametric exam preparation. So we will be dealing with the different subjects like sterilization as well as infection control, anesthesia and pain management, dental as well as maxillofacial trauma, dentoalveolar surgery, implant surgery, occlusion as well as dental anatomy, behavioral sciences, bioethics, pediatric pulse therapy, reconstruction as well as cosmetic dentistry, oral medicine and the diagnostic sciences, craniofacial deformities, orthognathic surgeries, questions or the syllabus that is related to the temporomandibular joint, patient education and also the ethics. Okay, so these are the important topics that is thought to carry the most significance in the parametric exam preparation. Okay, so in our live session, what we are trying to get in front of you is the basic conceptual clearing, which is in accordance with all of the different subjects that has been, or all of the different topics that has been mentioned here. Okay, yeah, so and as you all know, we also have a very dedicated office team which will be taking care about your data flow as well as the exam booking services. Just that we will be assigning per student, like whoever is joining with the academy. It is not necessary that you need to take coaching from us, but other than that, even if you are planning to take up only the data flow assistance as well as the exam booking, our office staff, we have a dedicated office staff who will be doing the same even without the coaching. So that will be of separate course. And for the further information regarding the data flow as well as the exam booking charges, you can get in contact with these numbers that has been mentioned here, because for each of the exams, the course might vary and I may not be the right person to talk regarding the data flow of all of these exams. We have a dedicated office team with whom you can connect with using the numbers that has been given here. Okay, so we do the license conversion and also the data flow of the general practitioners, physicians, dentists, allied health professional, nurses, pharmacists, physiotherapists, specialists, and also the consultants. Okay, yeah. And one thing that I would like to highlight is that whoever is doing the data flow from our academy, and also whoever is a student of our academy, that is whoever has purchased the course, they would be having a reduced amount when compared to that of the outsiders. Okay, so that is one thing that I would like to remind you here. Yeah, so let's just get into the most important topic that we are going to discuss today is regarding all you need to know regarding the different GCC exams and its preparation modes. Okay, so let's start with the most commonly opted DHA exam. As you all know, DHA is the exam that you need to pass, which would allow you to work in Dubai, and it is the exam that is conducted by the Dubai Health Authority, and the exam pattern goes like this. The duration is 170 minutes and the number of the questions is 150 minutes. The number of questions is 150. So basically, you have the DHA General Dentist examination in which you will deal with 150 MCQ questions over a time period of 170 minutes. And to talk about the requirements. So whenever I get the queries, the most common requirement or the most common query that I keep getting is regarding the experience and also regarding the result validity. So you need to have a BDS or an equivalent degree, and you need to have 2 years of experience after internship in order to activate your license. And the period will be calculated from the day you received the BDS certificate or the license registration, whichever comes last. And the result validity is 5 years, and there is no need that we need to complete our data flow prior. So on this context, let me just try to give you a relevant information. So most of the students, though they have a vision that they are going to prepare or they are going to plan for Dubai, most of them have a tendency to wait or to complete this entire 2 years of experience and then start with the exam preparation. Actually, that is not a very important or you need not go with such a long weightage, because of the fact that there is no need of prior data flow, and also because the result validity is 5 years, you need not wait for the entire completion of this 2 years. The fact is that you can write the exam the very next day after your internship, just because the result validity is 5 years, and within this 5 years, you need to complete this experience, and then you will have to start on with your data flow. Okay, so I hope this information would be very relevant, and also most of you might get benefited out of this particular information that I have just given to you now. So basically, you need not wait for the completion of your experience to start your preparation. Yeah, and now to talk about the passing criteria. The pass score is 60% of as an aggregate, 60% and above aggregate, and the key subjects that you would be dealing will be the restorative dentistry, the oral medicine or the surgery, as well as the periodontics, and then we have this pediatric or this ortho, and then the most important highlighter, what makes this DHA quite different from that of the other examinations, is that you must score 60% aggregate and also 60% at least in 2 key subjects to pass. Okay, so this is one variation when compared to that of the other exams that you need to deal with. So generally, I am not a big fan of this slide, because this is the template that has been given by the different examination conducting authorities, but many a times we can't rely upon this same pattern. So this is the general pattern in which, in the case of DHA exams, higher chances that they could ask these, that is from the topic of endodontics, they could ask nearly 20 questions. From oral medicine as well as surgery combined, they can ask 31 questions. And then prosthodontics as well as operative dentistry, they could ask 46 questions. From periodontics, it is 27. And ortho and pedo combined, it is 26. Okay, so this is just, they have given the subject weightage. Okay, so as I told, you can't rely on it completely, but this is the most commonly followed pattern. Yeah, now to talk about the MOH exam 2025 and all you need to know regarding the same. So to talk about MOH, as you all know, the different we have different Emirates. So other than for this Dubai, whenever it comes towards to practice in the other Emirates, like in Sharjah, Ras Al Khaimah, or Ajman, when talking about all of the other Emirates, as you can see, the ones which is mentioned here, Al Quwain, Fujairah, etc., you need to pass the MOH exam. And passing this MOH exam allows you to work in all of the above mentioned Emirates of this UAE. And then to talk about the exam pattern, it comprises of 150 multiple choice questions and the duration being 3 hours. And then the requirements is BDS or equivalent degree and 2 years of experience after internship. And again, just like how we spoke about the DHA, the experience will be calculated from the day you receive the BDS certificate or the license registration. And the self-validity stays the same for 5 years. And the prior data flow requirement is a strong yes. That is the reason why you have to complete 2 years of experience. Only then you can appear for the MOH exam. And the passing criteria being 60%, and the marks are not revealed. Now to talk about the DAH or the hard exam. So DAH is nothing but the Department of Health, and previously it was called as the hard exam, Health Authority of Abu Dhabi. So passing the DOH exam allows you to work in Abu Dhabi as well as in Align, and the exam pattern being 3 hours is the duration, and the MCQ and the number of MCQ questions is 150. And to talk about the requirements, BDS degree and 2 years of experience after internship, and the period will be calculated from the license, just like how we spoke about DHA as well as the MOH previously. The result validity stands the same, 5 years, and yes, it is a strict yes when it comes towards the prior data flow requirement. And about the passing criteria, a little on the upper scale when compared to that of this DHA as well as the MOH, that is, we need a passing score of 65% and above is considered as a pass for DOH exams. Now to talk about the Qatar exams, the QCHP, or now it is lately it is called as the DHP, that is the Department of Healthcare Professionals. So we have the QCHP or the DHA exams. So the qualifying exams would allow you to work in the state of Qatar, and the examination pattern, the updated pattern of this Qatar exams is in such a way that the number of MCQs is 150 questions and the duration is 3.5 hours. And again, we need BDS or equivalent degree and 2 years of experience after internship, and the result validity stands for 3 years, and the prior data flow requirement is a no. As I told, the same applies in the case, just like how I spoke about the Dubai. The prior data flow requirement is no, because of which, though you are done with your examination, the very next day you can start preparing for the exams, because the result validity stands for 3 years, and within this 3 years you need to complete your 2 years of experience. So again, you need not wait for the completion of 2 whole years of experience before you prepare for the same. And the passing criteria stays at 60%, and you can take up the exam to nearly 3 times in 1 calendar year. Yeah, so let me just take your attention towards this particular slide. So this is the blueprint or the updated weightage of the different subjects, and also the questions from each of these, and also the general passing score. So as stated before, for the Qatar exams, we have 150 MCQs, which is being timed out at 3.5 hours, and the passing score being 60%, wherein you will have questions regarding the scientific knowledge, that is the biomedical sciences, evidence-based practice, and then they will be also evaluating your clinical skills. So that is a major part from where you had been getting a lot of questions. Let it be the patient assessment, comprehensive treatment planning, health and safety, management of emergencies, disease prevention, control of pain and anxiety, periodontics, pediatric dentistry, orthodontics, restorative dentistry, endodontics, prosthodontics, oral surgery, as well as the oral medicine. So please do not get worried just because you are seeing a very big list here. Our academy's classes are being space, or it has been made in such a way that we will be guiding you towards all of these preparations in detail. Okay, so just that they have given it in a little detail just to notify you that these are different areas from where you need to expect the questions for examinations. And then they will also evaluate your effective skills like the communication skills, professionalism, your knowledge and ethics, as well as the legal areas, and also the team working management and the leadership skills. Okay, so just have an idea regarding this QCHP and the latest guidelines that they have given regarding the evaluation. Yeah, not to talk about the OMSB exam. All you need to know regarding the Oman exams, that is the Oman Medical Specialty Board exam. So passing this exam would allow you to work in Oman, and the exam pattern goes like this. Quite contrast or quite different from whatever we just learned previously. That is 2 hours as well as 30 minutes as the duration, and the number of questions being just 100 MCQs, and the requirement is BDS or equivalent degree. And this is a recent notification for which we had a long debate or a long wait to know regarding what exactly is the truth regarding this experience that has been mentioned here. So until 2024, it was always 4 years of experience post internship, but as per the latest rules, it has been 10 years of experience. So probably the good side, whenever we are preparing for any examinations, it is always good to be optimistic, isn't it? So the good part in this case is that now the number of the students, whoever has been attending this OMSB exam, has come down because of the strict experience or the strict requirement that they have been given here, that is 10 years of experience after internship, because of which there is a very good chance that whoever writes the exam with a very nominal or a very good amount of preparation, high chances that they can clear the exam as well. Okay, and the result validity is just 1 year. So within this 1 year, you need to clear the exam. Like once when you clear the exam, within this 1 year, you have to activate it into the license. And many of you might know that in the case of Oman, we also have a Viva once when you clear the irregular MCQ exam as well. And again, the regular data flow requirement or the prior data flow requirement is a no here. And the pass score for this Oman exams is 65%. And just like how I told, there is a Viva before you can start looking for the job opportunities. Yeah, so here is the blueprint, or this is how you can see the syllabus has been given regarding the Oman exams, wherein we have the most of the common subjects that we deal, like the pediatric dentistry, periodontics, special care dentistry, orthodontics, common competencies, prosthodontics, endodontics, oral medicine, as well as surgery, and also the operative dentistry. So these are the number of the questions that is being generally asked, and altogether makes a total of nearly 100 questions. Yeah, now to talk about the MOHKW or the Kuwait Dental Licensing Exams. So it allows you to, or passing this exam allows you to work in Kuwait, and the exam pattern is 3 hours and the number of questions being 150 MCQ questions. And for practicing in Kuwait, you need to have a BDS or an equivalent degree with 6 years of clinical experience after internship, and the result validity is there for 5 years, and there is to talk about the prior data flow requirement, it is a no. And then the pass score being 60% in the case of this MOHKW. And again, you need to go with the Viva once when you clear the MCQ exam. Now to talk about the NHRA, that is the Bahrain Licensure Examinations or this National Health Regulatory Authority of this Bahrain. So this allows, or passing this NHRA exam allows you to pass in Bahrain, and the exam pattern is like this. We have 150 multiple choice questions timed at nearly 3 hours, and the requirements being finishing BDS or the equivalent degree, and you need to have 5 years of clinical experience after the internship. The result validity is 5 years, and the prior data flow requirement is a no. And then to talk about the passing criteria, the pass score is 60%. And a fact that you need to know regarding the NHRA is that you can attend the exam only once when you start getting the job offer. So we need to have an employer, only then you can write the exam. Yeah, now to talk about the Saudi Dental Licensing Exam 2025 and all you need to know regarding this SDLE exam. So passing the SDLE exam allows you to work in Saudi Arabia. So the exam pattern quite different from whatever that we just read or what we just went through all these slides back. That is, the current duration for this SDLE exam is 4 hours with a breakdown or with a break of 30 minutes. So we'll be having nearly 200 MCQs, and we have a break of 30 minutes after the 2 hours. And then the part 1, wherein you will have 100 questions, will be regarding this endodontic case scenario based questions, endodontic diagnosis, and also some orthodontics questions. And then you will have a break of nearly 30 minutes. Then you get into the part 2, again 100 questions, wherein you will have the questions regarding the periodontics, implantology, as well as the surgery questions. Yeah, so the requirements is BDS or an equivalent degree, and it is 1 year for private, and it is 5 years for getting into the government setups. And the result validity is 1 year. And to talk about the prior data flow requirement, yes, it is a strict yes. And also the pass score is quite high when compared to that of the other mentioned examination. It is nearly 68%, and the pass score of SDLE is nearly 542 points on total of 800. Okay. So to be very frank, to talk about this SDLE, at the moment, they have restricted the entry of other nationalities, and they have been trying, or they have been taking a little more effort in taking their own nationality. So that's the reason why, or that is probably because of that, we have a little number of less students who have been taking up the general dentist. Whoever has been taking up this SDLE examinations is quite less these days because of the changing norms there. Yeah, so just like how I spoke previously, these are the different syllabus for a general dentist in all of this GCC examinations. And basically, though they have listed out all of these topics or all of these syllabus, the examination shall contain questions that test the knowledge, and the questions with scenarios that test the skills like this interpretation, as well as the analytic skills, decision-making skills of a doctor, reasoning, and also the problem-solving skills. So in order to guide you for all of these, that is why we are here to give you a prep, or that is why we are here to guide you regarding the different examinations, the different topics, and how actually you need to prepare. So many a times, though we are a part of this academy, you know that once when we give the study materials, most of you will have a tendency to think that once when we get the study materials, you can study it from your own end. Yes, there is nothing wrong in thinking that way. But what happens whenever you join with an academy wherein we have a timetable which is like set in such a way that in 45 days, we are here to complete all of the portions or all of the syllabus that has been mentioned, because of which you actually speed up your preparation in such a way that whenever you are joining or whenever you are into this course, just with the flow, you tend to complete all of these portions pretty faster rather than studying from your own end. So that is the reason why I would highly recommend to join to the different academies, which will actually give you a basic live session clearing sessions, and also the recommended tests, as well as the topic wise tests, as well as the mock test, etc. So before we start with the demo class, let me just tell you regarding how the system runs in our academy. So just imagine that today the class, or from today for the next 5 days, we will be having sessions on periodontics. So the first session on periodontics is regarding the growth, development, as well as the occlusion. So once when I deliver the session, or once when you are attending the live session, soon after that, I will be asking you guys to go back and to check the topic wise questions that is mentioned in the app of Samson's Medlin Academy. So from that particular topic, whatever has been asked previously for your examination is been just mentioned there, or that has been put up as a number of nearly some 20 to 25 questions. So once when you attend a particular session, you are bound to go back and to attend the topic wise questions, that is the questions that has been asked previously. And then tomorrow you will have a class in which we are talking about the pulp diseases. So once when you attend that particular session, again you will have to go back and to attend the topic wise questions, wherein you are going to deal regarding the different questions from the topic of this pulp diseases. And then the third class will be on the caries activity test, as well as the fluoride and the other anti-fluoride and also the other anti-caries programs. So once when you attend that particular session, again you will have to go back and to attend the topic wise questions that is given in the app. So basically, as and when you pass by each day, you clear the subject, that is you clear the important session, followed by that you attend the necessary questions. So that is how eventually you will definitely develop a confidence in the subject. And above all, though you have a best mentor, or though you have reached into the best academy, it's all about how much effort that you put in your side as well. Okay, so it is very important that we have n number of study materials as well as a vast number of MCQs. So most of you would be getting the 8 o'clock question. So it has been since so many years that we have practiced that we provide a free general dentist sample questionnaire link, which is timed out, or like which is for the next 5 minutes, and it is generally being put up in our group at 8 o'clock. So most of you must be aware regarding the type of the questions, or the most common, or probably the most latest type of questions that you would be getting for the GCC examinations. So it is very important that you have to put in the effort from your side as well. And along with that, we are here to help you with the basic preparation as well. Okay. Yeah. So without any further ado, let's start with a demo class or a model class. So this is how we will be taking the classes in the Samson's Medlin Academy. So let's start with the growth, development, as well as the occlusion part of periodontics. So the odontogenesis, as you could see here in this image, the tooth development or odontogenesis is the complex process by which the teeth form from this embryonic cells, and then they later grow and erupt into the mouth. Okay, so that is what is called as odonto, that is teeth, and genesis is nothing but the formation, beginning, or creation. Yeah, so you could see multiple steps that are involved in the process of odontogenesis. Just like how we spoke previously, it is a complex process wherein we have the ones which has been marked here, where I'm running the pointer currently is the oral epithelium. So you can see that the oral epithelium grows into this neural crest derived mesenchyme, and then there is initiation or the thickening of the same, and then you could see that the later stage is the bud stage, and then you could see the cat stage, and then you could see that it grows in the shape of a bell, and that is called as the bell stage, where we would see the different types or the different subcategories like the histodifferentiation stage, morphodifferentiation, apposition, as well as the maturation. And then finally, you could see the erupted tooth into the oral cavity. So these are the basic steps that you need to know regarding the odontogenesis. Yeah, now to talk about the initiation stage, which is generally seen around 6 weeks of this in utero lifetime period. So whenever the questions are being asked, the question would be like, what is that particular time in which you could notice initiation of a tooth bud? And then the questions would be like option A, 6 weeks in utero, option B, 10 weeks in utero, option C, 1 month, etc. Okay, so just have a very good idea regarding the ones which has been bolded here and the ones which have been highlighted in this red color. So the initiation actually happens around 6 weeks of this in utero lifetime period, and you could see the oral epithelium or the outer layer or the dental lamina is the first evidence of this forming or this budding teeth, and this is the ectomesenchyme. So the signals overlying the oral epithelium to proliferate into the dental lamina is what you would see in this ectomesenchyme. And now to talk about the defects. So whenever you see or whenever you have some sort of defects in this initiation stage, that is when you will end up with the defects like congenitally missing tooth and also the tooth that is more in number, that is the supernumerary tooth. Okay, so pay special attention. As I told, the ones which has been marked in this red color are the ones which has been previously asked for examination. So the defects that you would see in the case of this initiation stage would be the congenitally missing tooth and also the supernumerary tooth. Yeah, now to talk about the bud stage. So as you could see here, as it is mentioned here, there is, or this bud stage happens around 8 weeks of in utero lifetime period. And during the bud stage, the dental lamina grows into the mesenchyme in the shape of a bud, hence the name bud stage. Okay, so we can see that the dental placode grows into a proliferating bud, and all of the primary as well as the permanent molars arise from that of this dental lamina. And then the ones which has been marked in this navy blue color is the condensing mesenchyme. And again, to talk about the defects that you would see as a result of mistakes in bud stage, it is again the congenitally missing tooth and also the supernumerary tooth. So the question could be like congenitally missing tooth, or whenever these days there is high chances that they could ask the question in a clinical mode. So a patient of 4 years come to your dental practice, and then when you did the basic oral checkup, you notice that the patient has multiple teeth missing in the oral cavity with no evidence even in the radiograph. What do you think, or in which, or the defect in which particular stage has led to the present condition? And then the option that you will have would be the bud stage, the cap stage, and all, or probably the apposition stage or the maturation stage. Okay, so what do you think is the perfect answer? Option A says bud stage, option B says cap stage, option C says maturation stage, and then option D says apposition. What do you think? Based on whatever you just listened now, just feel free to answer it. Even if it's wrong, it's okay. Just unmute your audio and just let me know. What do you think is the perfect answer for my question? Anybody?
Bud stage.
Obviously, it is the bud stage. Okay, I hope whoever has not answered has got the idea. Probably it is because you are quite reluctant to answer it on a public platform. I believe that could be the reason why you have just kept yourself mute. Anyways, my question was regarding where do you see the defects like congenitally missing tooth, or probably the presence of more number of teeth, that is the supernumerary teeth. So that basically occurs as a result of defects in this bud stage. And another, now to talk about the second stage, that is the cap stage. So as you could see here, it happens around 9 weeks of this in utero lifetime period. And then we have the enamel organ, in which we have this outer enamel epithelium, which gives the outer cell layer, inner enamel epithelium that gives the inner cell layer. And then we have the stellate reticulum between the layers. And then there is also the enamel knot, or the ones which would give the cusp tips. So the one which has been marked in this royal blue color is the dental papilla, which is responsible for the formation of dentin as well as the pulp. And then we have the dental follicle, that is the surrounding sac. So in the case of this cap stage, the tooth bud differentiate into a cap-shaped enamel organ extending from the dental lamina. And now to talk about the defects, as I told, please pay special attention towards all of the defects that has been marked here. So the different defects would be the cyst, the odontoma, gemination, fusion, as well as the dents and dentate. So all of these defects that has been mentioned here occurs as a result of the different mistakes or the different problems that you would encounter in the cap stage. Now to talk about the belt stage, as I told, which has different subcategories. So this belt stage is seen around 11 weeks of this in utero lifetime period, and that is where you will have the different substages like histodifferentiation. That is, the transformation into the distinct cell types happens here. So this IEE, the inner enamel epithelium, forms the ameloblast, and then we have the dental papilla, which would form the odontoblast. And now to talk about the different defects in this histodifferentiation stage, we have the amelogenesis imperfecta, and then we could see the defects like this dentinogenesis imperfecta. Yeah, now to talk about the morpho differentiation, which again is seen around 11 weeks of this in utero lifetime period, and the shape as well as the size of this eventual crown is determined during this process. And then to talk about the defects that you would notice in the morpho differentiation stage is the size as well as the shape abnormalities like the spec laterals as well as the macrodontia. Okay, so this again could be asked as a clinical based question. You a patient has come in front of you and then you notice that the patient's laterals are peck shaped, or the patient had peck shaped laterals. What do you think is the reason for the same, or the defect at which particular stage has led to the formation of the spec laterals? And then what should be the answer?
Morpho differentiation.
Yeah, just feel free to answer. I'm not here to judge anybody of you, just to know whether you have understood what the question and how well you can answer it. That's it. What do you think is the defect, or what is that particular stage wherein you will see the defect of peck-shaped laterals? What is the answer?
Morpho
There
differentiation
is
of
morpho
differentiation.
differentiation.
Okay, yeah, very good. Now to talk about apposition, which happens around 14 weeks of this in utero lifetime period. So we have the odontoblast, which deposits the dentin matrix, and then we have the amyloblast, which would deposit the enamel matrix, and then we have the cervical lobe, that is where the inner enamel epithelium as well as the outer enamel epithelium would join together, and that is where you would see the HERS, that is the Hertwig's epithelial root sheath, and also we have the epithelial cell rest of this malassez. And now to talk about the defects that you would see as a result of different mistakes in apposition is the presence of this enamel hyperplasia, enamel pearls, and also the concrescence. Now to talk about the maturation stage, which happens around 14 plus weeks of this in utero lifetime period. And as you know, it is in this maturation stage that you would see the deposition of enamel as well as the dentin. And then to talk about the defects, what are the different defects that you would notice in this maturation stage? You will see the problems like enamel hypermineralization, fluorosis, as well as the tetracycline staining. So just have an idea regarding each of this. Yeah, so as a summary, you know that the tooth germ has enamel organ in which we have the amyloblast, which gives rise to the enamel, dental papilla in which we have the odontoblast, which gives rise to the dentin, central cells which gives rise to the pulp, and then we have the dental follicle in which we have the cementoblast which gives rise to cementum, osteoblast which gives rise to the alveolar bone, and then we have the fibroblast which would result in the formation of the periodontal ligament, that is the PDL. So by now, all of you would be very much confident regarding the different stages of the tooth development and the problems that you would see in each of the stage and the results or the resultant defects. Even then, as I keep telling, how much of a theory you study, it's all about how much you can retain it in your memory and how you can put in that theory in such a way that you are able to pick up the right answer when the questions are in front of you in the form of this MCQs. Okay, so let me just take up to the summary of whatever we have learned until now. So to talk about the stages of tooth development, we have the initiation stage, which you would notice at 6 weeks of in utero lifetime period, bud stage at 8 weeks, and then we have the cap stage, which is at nearly 9 to 10 weeks of this in utero lifetime period, and then we have the bell stage, which is nearly 11 to 12 weeks, in which we have the histo as well as the Morse differentiation. And then we have the apposition as well as the calcification, and this actually varies per tooth. Yeah, so to talk about the tooth formation, which should happen in the first trimester. And now to talk about a tooth calcification. So this was a question which has been asked previously. So when does the tooth calcification happens in the case of a primary teeth? What is it written here? From which trimester? It is from the second trimester. And now to talk about the permanent teeth. When does this tooth calcification happens in the case of this permanent teeth?
From birth.
From birth. Okay, so just because you're seeing a lot of facts lined up from 1 to 10, it doesn't mean that you're going to get confused. No, in the first read, everything is quite confusing. Let it be any topic, or let it be any, even if the topic is quite simple, it tends, or the first time when you're reading it, you might find that, okay, it is something which is quite new. So the second time when you're reading it with much more better concentration, it will actually register in your mind. Okay, so though you're finding a few topics quite difficult in the first read, it's absolutely fine. It is the case with not just you, but with every other student. Just that you have to put in extra efforts in such a way that, as I told, the ultimate idea is that once when you are in front of your laptop, or once when you're in front of your MCQ questions, whatever theoretical knowledge that you have gained, it should help you out to pick up the right answer from the 4 options that has been given here. Okay, that's it. Yeah, now to check out the problems in this initiation stage. So the initiation stage will result in the problems like, yes, could you just repeat this and repeat the defects that has been lined up here?
Anodontia,
Apodontia,
Oligodontia,
supernumerary. As I told, the missing as well as the extra number of teeth are all related to the problems in this initiation stage. Now to talk about the problems in cap stage, that would result in the defects like
Dentin dentin,
fusion,
germination as well as the cyst. And now to talk about the problems in histodifferentiation. So that is where you would see the different types of imperfectas like the amelogenesis as well as the dentinogenesis imperfecta. Now to talk about the problems in morphodifferentiation. That is where you would come across the different defects like macrodontia or the microdontia, the loss of cusp, the peck-shaped laterals, Hutchinson's laterals, etc. They are all or they would all be seen as problems whenever there are defects, or these are the defects that you would see as a result of problems in the morphodifferentiation stage of this odontogenesis. Now to talk about the problems in apposition. So that is where you would see the defects in enamel, dentin, and cementum. That is, we have this enamel hypoplasia, enamel dysplasia, concrescence, etc. And then we have this calcification stage. That is where you would come across the different mineralization problems. That is, the trauma or the systemic fluoride ingestion would cause hypocalcification. Each tooth has an ectodermal and a mesodermal component, the forming giving rise to the enamel. That is, the ectodermal component would give rise to the enamel, and the mesodermal component would give rise to the dentin, cementum, pulp, and the PDL. Okay, so just have a very good idea regarding all of the theoretical sentences that you have given, that you can see here. I always tell to my students, whoever is attending the daily sessions, like once when you have attended the basic life conceptual clearing sessions, the second time when you are going back and reading the same slides, so in the Samson's Medlin Academy's app, whatever has been taught to you, the same material, so whatever is relevant is being given to you in the form of PDF notes. As you all know, it's completely online academy as of now for the dental, because of which all of the notes will be given in PDF format in our Samson's Medlin Academy's app. But if at all, if you are a paper person, you have the provision to download it and you can study it as papers as well. So anyways, the entire idea is that once when you attend the session, and once when you're going back and when you're reading the same slides, please make sure that you do not invest more than the required time for any of the slides. Try to finish all of those, like whatever has been taught already in the class, just in a speck of 1 minute or maximum 2 minutes, you have to skip to the next slide. As I told, the entire idea revolves around how well you are able to use your theoretical knowledge in solving the right answer from the given options in the MCQ questions. Yeah, so let me just check how well you have understood whatever has been taught until now. Just feel free to give the right answer. Even if the answer is wrong, it's completely fine. We are not here to judge any of you. Defect in the early development and formation of the teeth will result in which of the following anomalies? What do you think is the perfect answer? Okay, so whoever has answered it, it is right. It is the oligodontia. As we studied, any defect that is related to the numbers, that is either missing or whatever it is supernumerary, it's all related to the which stages? What are the early stages that we just studied?
initial stage.
Yeah, initiation stage or the bud stage. Okay, very good. Yeah, now to talk a little bit about the development of occlusion. So we'll have the different stages like this. We have the gum patch stage, and then we have the primary dentition stage, the mixed dentition stage, and also the permanent dentition stage. So to talk about the gum patch stage, so that is what you would see from birth towards the 6 months, ending with the eruption of the first primary tooth. The future position of the tooth can be observed by elevations and grooves present on the alveolar ridges. So basically it lasts for nearly 6 months after the birth, and then gum pads are nothing but the alveolar processes at the time of birth. So we have the gum pads which are seen in pink in color, and they are firm in appearance, and they are covered by the dense layer of fibrous periosteum. And you could see the ones that are segmented by the grooves, that is nothing but the transverse groove, and each segment is a developing tooth side. And then the parts are getting divided into the labiobuccal as well as a lingual portion, and that is by means of this dental groove. So just have a very good idea regarding the segmented by the grooves like transverse groove, and the ones which are divided into labial as well as the lingual portion is by the dental groove. Yeah, so this was a question which has been asked previously. Whenever you are talking about the gum patch, we have a group that is present between the canine as well as the first molar region. So that is what is called as the lateral sulcus. So what is the sentence that has been written here? It's a previously asked question. So the lateral sulcus is useful for
Judging interact relationship at early stage.
at the early stages. Okay, so that was a previously asked question. So as I told, whenever you are reading a number of theoretical sentences, you just have a tendency to skip these sentences. But once when the question is in front of you, which among the following grooves is helpful in judging the inter-arch relationship? And then you have the options like transverse groove, dental groove, as well as the lateral sulcus. So what is the perfect answer?
Lateral sulcus.
Okay. Yeah, so that is how you have to study. As I told, how much of a theory you learn, make specific time period in such a way that you should invest most of your timings in solving the MCQs, which we have enormous number of MCQs in our Academy's app as well. Yeah, now to talk a little detail regarding the upper gum pad. As you could see, we have the horseshoe shaped, and horseshoe shape is the shape of this upper gum pad, and it can you can have the gingival groove, the one which separates the gum pad from that of the palate, and then you have the dental groove, which starts at the incisive papilla backward until the gingival groove. And then you could also see the lateral sulcus, which is quite useful for the interarch relationships judging. Yeah, now to talk about the lower gum pad, it is in the U-shaped and it is rectangular, which is characterized by again the gingival groove, and then you have the dental groove, and then there is also the lateral sulcus that has been present here. Now to talk about the primary dentition stage. So from birth until 6 months, as we already studied, that is the gum pad stage. Now when to talk about the 6 months to 6 years, ending with the eruption of this first permanent molar, we know that that is what is called as the primary dentition stage. So this is how a classic appearance of a dentition of a child who is in between this 6 months to 6 years would look like. Yeah, now to talk about a little bit about the dental spacing, a very common, at the same time, a very important topic that you need to know regarding the dental spacing is that you would say different spaces like this interdental spaces, and then you would notice the primate spaces and also the leeway spaces in this primary dentition. Yeah, let's study about the physiological spaces or the developmental spaces. As you could see, whenever a 3-year-old or a 4-year or 5-year, 6-year-old kid comes in front of you, you would see that there are normal spaces just like that in between the teeth. Okay, it's a very common or a striking feature that you notice such spaces. So this regular or this accepted spaces that is seen in between the dentition or in between the tooth of each of these age group is called as the physiological or the developmental spaces. So how much is it in the maxilla?
4 mm.
4 mm. And what about in the case of mandible?
3
3
mm.
mm.
Yes, so clinically, most of you would be clinical dentists, and it's a very common question from the parents' part that they keep telling us or they keep coming to us telling that we notice spacing even now in the case of my daughter or my son at this very young age. So what should be your answer if the spacing appears like this?
It is
Is
normal.
it normal or should we treat it?
Normal.
It
No,
is
it's
normal,
not.
and that is what it is called as the physiological or the developmental spaces. Now to talk about the mixed dentition stage, that is from 6 years to 12 years, ending with the exfoliation of the last primary tooth, and that is where you would see the molar relationships and its transition to class 1, class 2 or class 3. Yeah, so to talk about the mixed dentition period, in which we have 3 phases, that is the first transitional period, and then we have the intertransitional period, and then we have the second transitional period. So the first transitional period is characterized by the emergence of first permanent molars and the exchange of deciduous incisors with that of the permanent incisors. And then we have the intertransitional period, which is relatively stable, and this is where you would notice no specific change. Okay, so that is regarding the first transitional period. Now to talk about the intertransitional period, which is relatively stable. And now to talk about the second transitional period, which is characterized by the replacement of the deciduous molars and canines by the premolars as well as the permanent canines. Yes, so this is a previously asked question. So there is a shift in the lower molar from a flush terminal plane towards the class 1 relation. So from this flush terminal plane, and whenever it goes into the class 1 relationship, it actually takes up, or it actually happens in two methods. So we have something which is called as the early shift as well as the late shift or the later shift. So what is that particular space which has been utilized in the in this early shift? Early shift utilizes, or this early shift occurs by utilizing the
Prime
yeah, and then we have the later shift occurs by utilizing the
leeway space.
leeway space. Okay, probably you can remember it with the help of this L and L. Leeway space occurs by utilizing the
Ledge.
leeway space. Okay, later shift and leeway space. Okay, so just remember it like this. So basically we're talking about how from a flush terminal plane to a class 1, how the shift occurs by utilizing these type of spaces. Are you finding it difficult to understand? Are you able to follow all of these slides?
Yes, ma'am.
Okay. Even if it's a no, trust me, the first time whenever you're reading all of these, it's very common that you tend to get confused. Just pay special attention in such a way that whenever you are attending, or probably once when you're done with the session and when you go back and read the necessary slides, whatever has been taught in the class pops up in your mind, because of which it becomes very easy for you to solve all of the relevant questions as well. Okay. Now to talk about yet another important space, that is a primate space or the simian space or the anthropoid spaces. So as you could see here in this image, they are the ones which are seen mesial to the maxillary canines, the rounded areas, and distal to the mandibular canines. And these spaces help in the placement of the canine cusp of this opposing arches. So the difference between the combined MD width of the deciduous canines and the molars to the combined mesodistal width of the permanent canines and the premolars. So what is that difference space called as?
Leeway space of nuns.
Leeway space of nuns. And again, it's a previously asked question. What is the leeway space in the case of mandible?
3.4 mm.
3.4. And in the case of maxilla, it is
1.4 mm.
1.8 mm. Okay, so whenever it has been asked specifically about such or each side, that is when the one in the mandible would become 1.7 and the one in the maxilla would become 0.9. Okay, so to talk about those numericals, you tend to get confused whenever you're studying a lot of spaces like physiological spaces, leeway space, probably the the interdental spaces, etc. But what happens? Sorry, the primate spaces, etc. But what happens is, like, though it is numericals, once when you write it down and once when you certain things you have to just by heart or memorize or mug up, whatever it is. But once when you make that necessary movement, the second time when you come across such questions will only have the single best answer, because of which it is very easy to score marks for the same. Okay. Yeah. Now to talk about the incisor liability, yet another important space. The difference between the amount of the space available for the accommodation of incisors and the amount of the space available. So that is what is called as the incisor liability. So in the case of maxilla, how much is it roughly to be?
7 mm.
7 mm. And in the case of mandible, it is
5 mm.
5 mm. Okay, so it is roughly around 7.6 in the maxilla and about 6 mm in the mandibular arch. There could be minor differences according to the authors, but anyways, you can stick on to this. And now to talk about the ugly duckling stage, or we would also call it as the Broadbent phenomenon. So that is a self-correcting or a transient malocclusion. Self-correcting, that itself shows, or that itself tells that we need not go with any special intervention method. It corrects on its own. So that is seen in the maxillary incisor region. And what is the age group at which you would notice this ugly duckling stage?
8 to 11 years.
It is nearly from 8 to 11 years. Okay, so you could see that the diastema, which is considered as less than 2 mm between the upper central incisors, is what we would consider as normal. And you could see the mesial eruption of maxillary canines should close this space naturally. So this is again a very common clinical problem that the patients would turn up to. Patients would ask us, that is, there is space in between them. So it is just a normal phenomenon or a self-correcting anomaly which gets corrected on the eruption of the maxillary canines. Yeah, so here are the different self-correcting anomalies. So in the gum patch stage, we would have the different anomalies like this increased overjet, open bite, as well as the infantile swallow. And in the primary dentition, you would come across the different anomalies like anterior deep bite, flush terminal plane, as well as the primary spacing. And in the mixed dentition, you have the end-on first permanent molar relation, and also the ugly duckling stage in which the midline diastema is less than 2 mm. And then we have the mandibular lobar incisors crowding. And in the permanent dentition, you would also see overjet as well as the overbite. Okay, so these are the different self-correcting anomalies based on the different stages of tooth development. So keeping all those in mind, let's see a few questions that is asked from this area. Yeah, what do you think is the perfect answer here? In primary dentition, the anatomical structure that is used to determine the molar relationship. So just like that, we know that it is the flush terminal plane or mesial step or distal step. What is that one particular structure? Based on that, we come to a conclusion.
Distal plane of primary second molar.
Yes, it is the distal plane of the primary second molar. It is based on that we tell that it's a mesial step or a distal step or whatever it is. Okay. Yeah. So we have another question. A 9-year-old child came to the dental clinic with the spacing in anterior teeth, and the line of the treatment is which among the following?
No treatment.
Why do you think there is no treatment required in this case?
Ugly duckling stage.
Ugly duckling
Ugly
stage.
duckling stage. Very good. Okay. Yeah, it's a mixed dentition period. And it comes, the age of the child is 9 years. So what is that age I asked you to remember? Where we would see this ugly duckling stage?
8 to 11.
Very good. Okay. Yeah. Midline diastema present in the children is self-correcting if the diastema is not more than which of the following?
2 mm.
Okay. Yes. Again, the answer is correct. It is 2 mm. So those things, though, you can study it yourself. Once when we have a mentor and once when you're associated with an academy like this, it becomes very much easier, or we are here to guide you regarding where exactly you need to pay special attention. Okay, that's the reason why we are here with such demo classes or the regular classes, whatever it is. Okay, so try to attend it, followed by that immediately you have to go back and attend the necessary questions from those areas. That is how we prepare in this academy. Yeah, so coming back to another question, primate spaces are seen between, or primate spaces are the ones that you would see between?
Option A and
Option D.
Option D, wherein it says options A as well as B.
And
yes, okay.
B,
So whoever
yes.
has understood, you can very clearly get picture that those are the spaces. So the primate spaces are the ones that you would see mesial to the maxillary canines and distal to the mandibular canines. Yeah, one more question. The ugly duckling stage of the transitional dentition is characterized by all of the following except one. Maybe you will have to think a little bit, but it is quite easy.
mandibular lateral incisors erupting lingual to the mandibular central incisors.
Okay, let it be all other options that you can see. Let it be the A, D, B as well as D. All of them are very commonly seen in the images, or they are all characterizations of this ugly duckling stage. Whereas when it comes towards the option C, mandibular lateral incisors erupting lingual to the mandibular central incisors, it is never a characterization of this ugly duckling stage, because of which you can omit option C, or the right answer here becomes option C. Yeah, again, a simple question. Just try to answer it. What do you think is a perfect answer here?
Leeway space.
Yes. And what is that clue or mnemonic I asked you to remember? You can remember it with the help of L and L. Okay. So what if the question was regarding early mesial shift? What would have been the perfect answer?
Primate space.
Primate space. Okay. Very good. So here the answer is the leeway space. Yeah. This is one more question, not the one for which we have learned the theory, just a general question. At times, you also need to expect such questions. That is just like that, you have to study it. What do you think is the answer here? Interincisal angle in primary dentition.
150 degrees.
Okay, so such questions you have to just study it like this by heart. It is the 150 degree is the perfect answer. Yeah, so this is a little bit regarding the anterior transition. As we all know, the permanent tooth buds always erupt lingual and apical to that of the primary teeth, and then the incisors tend to erupt lingual except for the upper centrals. And this is regarding the primary molar relationship, wherein we have the mesial step. As I told, it is the distal plane of the second primary molar that actually determines the different molar relationship. So this image here shows the mesial step. This is the flush terminal plane, and this is the distal step. Yeah, so this is regarding the posterior transition. Towards the posterior side, you can see that the first permanent molars are guided into the position by the terminal plane, and this flush terminal plane becomes class 1 by differential teeth shift and by differential jaw growth. So we have the early mesial shift of this first molars. So that is by, or that occurs to close this primine spaces, and then we also have this late mesial shift that occurs by closing the leeway spaces. And then there could also be late mandibular growth. All of this would tend, or all of this would result in the changing of this mandibular relation or this primary relationship towards this class 2 end on or the class 1 or class 3. Yeah, so just for your better understanding, you can see here that whenever you have the molar relationship in a primary dentition being, let it be the distal step. So you can experience, or probably you can expect that there could be 3 ways of changes. So there could be 3 methods by which it can get into these ones that has been mentioned here. So the one which is marked in this red color is the minimal growth differential. So whenever the child is having a distal step and whenever there is a minimal growth differential, high chances that the distal step would become
Class 2.
Class 2. And whenever the one which has been marked in this dashed lines here is the forward growth of mandible. But though the child is having a distal step, but there is a forward growth of the mandible. In such a situation, you can see that the relationship goes from this distal step to end to end. And whenever we have a shift of the teeth, again, you could see that it could become shift. Whenever there is a shift of the teeth, you could also see that the distal step would become end to end. So basically, most of the cases you would see that the distal step would become definitely into the class 2, that is angles class 2. But in certain situations like the one we just mentioned here, it could also take, or it could also have a tendency to become end to end. And then this is the flush terminal plane. So the one which with minimal growth differential, you could see that it will result in this end to end, and with the forward growth of mandible as well as the shift of the teeth, it could also become class 1. And in the case of mesial shift with minimal growth differential, what is the relationship that you have to expect in the case of a mesial step?
Class 1.
It is class 1. And then you could also see whenever there is a forward growth of the mandible or whenever there is a shift of the teeth, high chances that it could also become
Class 3.
Class 3. Okay, so just have an idea regarding how this regular or the primary second molar relationship would change into the ones which has been mentioned here. So to talk about the mesial step type, the first molars erupt directly into angles, class 1 occlusion. And then to talk about the distal step type, the first molars erupt directly and definitely into that of this angles, class 2 occlusion. Okay, so just have an idea regarding each of this. So based on that, we have a terminal plane prediction. So to talk about the flush terminal, so whenever it is a case, high chances that the flush terminal plane would become class 1 in nearly 56% of cases, and it can also become class 2 in 44% of cases. And then the mesial step, it will become class 1, or there is also a chance that it would become class 3. And then to talk about this distal step, high chances that the distal step will surely, or high chances that it will very commonly become
Class 2.
Class 2. Okay, so this is something which is highly predictable. So keeping all those in mind, just think a little bit and just give me the right answer. What do you think is the perfect answer here? Mesial step formation in the deciduous dentition is indication of future. Which among the following? Mesial step.
Class 3. Class 3.
Confident enough? If not class 3, what would have been the other perfect answer?
Class 1.
Class 1.
Very good.
Class
As we
1.
do not have class 1, the perfect answer is class 3. Okay. Yeah. So that is regarding a demo class. So looks like it has been correct 1 hour, and I have tried to give you a idea regarding how the demo class or how a session of a Samson Medlin Academy would look like. So whoever is interested in joining, just let me know. So these are the phone numbers that you need to contact for inquiry. That is, as I told, regarding the course and probably regarding the data flow as well as the exam booking. Whereas the one which has been given here, this is my personal number where you can contact me so that I can give you the relevant details. So whoever is planning to purchase the course, this would be the right time because we have an offer running now, because of which the current offer price is 12,000 for a subscription of nearly 6 months, and the new batch starts from the upcoming Monday. So from this moment, the course price would be 12,000. So whoever wishes to join, you can just purchase the course. And if there is any doubt related to the purchasing or regarding how to go with the next step in the purchase, just feel free to contact in any of the numbers that has been given here. Okay. So once again, thank you so much. You may all leave the group now. And if there is any queries, please feel free to message me in this number here. Okay. Thank you so much.
Thank you, ma'am.
Okay.